Hello, this is Ben Chateau here, physical therapist. I wanted to talk to you today a little bit about knee pain and using a compression band or a mobility band to treat that pain. So in a previous video I talked specifically about how to apply the band for IT band pain, which also can feel like knee pain, though it's from a little different cause. Today we're going to talk about more patellar tendon pain. And the patellar tendon is right here, and it blends into the kneecap here and as it becomes the quadricep muscle. And the way you're going to apply the band is just below the start of the tendon here. And there's usually a lot of times there's a bump right here. That's the tibial tuberosity. And that's where you want to start the band, just below that. So put the band right like that, and we want 50 to 75% stretch. Now go around a couple of times, make sure it's on real good, and get that nice good stretch, because we're going to keep the band below the knee. Right there. And we're going to stop before we go up over the kneecap. And now with the rest of the band, I'll just kind of go back over that patellar tendon a little bit more. And we're going to do two actual exercises with this. Tuck it in here on the side so it's out of your way but easy to get to. Now if you get any numbness, tingling, severe pain, you got to discontinue the treatment. We don't want to cut off the blood supply too much. We obviously don't want to pinch any nerves. Once you get the band on there, we're going to start with knee extensions, back and forth. I usually go about 30 seconds. And after knee extensions, we're going to go into some squats. Now you might need to hang on to something. Again, there's my kneecap, so it's getting that tendon in that painful area. And we're just going to start with some smaller squats, get full range of motion. With extension, now you won't get full range of motion with your flexion at first, but if you can, get to where you can get all the way down, all the way up. And we'll go maybe 60 seconds of squats. If you start to get numbness or tingling, discontinue. Just like that. And then we remove the band. Now the hope here is that compression will work in two different ways. Neurologically, it might reset some of the receptors that control stretch. It might also affect pain neurologically. And then that compression will hopefully bring more blood flow to that tendon and help it heal a little bit faster. I typically advise 3, 4, 5 treatments a day, assuming you're not on any blood thinning medications or have a blood clot disorder. Again, the focus is on that patellar tendon. See how it feels 3 times a day. If it's on the right track, feels like it's feeling better, up the amount you do it. Maybe 4 times a day, 5 times a day, and I would continue this for about a week. And then as you're doing this, continue with your normal strategy for treating your patellar tendinitis, including pain and some exercises. You can find more information on how to treat patellar tendinitis on my site, thephysicaltherapyadvisor.com. Also, please join me on Facebook at thephysicaltherapyadvisor.com. Submit your questions either via Facebook or email at ben@thephysicaltherapyadvisor.com. Thank you.